Thank you so much for joining us for our interview day. My name is Brett Young. I'm the OB/GYN Program Director, and we are so happy that you've joined us today, and we look forward to telling you more about our residency program. Our goal of the OB/GYN residency program is to cultivate leaders in the breadth and field of obstetrics and gynecology with extraordinary clinical training and a broad range of individual opportunities in research, global and community health, and quality improvement. It is the program's goal to continue to graduate well-trained clinicians who will become academic leaders in the specialty of general obstetrics and gynecology and all of its subspecialties. Approximately 50% of our trainees join subspecialty field through fellowships, and 50% of our trainees become academic generalists. We cultivate these leaders by harnessing the passion that they bring to their education and their future career. We support residents by tailoring their residency through 2 elective blocks, research opportunities, and access to mentors in the area of quality improvement and assurance, medical education, and global and community health. And we celebrate their diverse backgrounds and experiences of our faculty and trainees.
Hi, my name is Dr. Huma Farid, and I'm the Associate Program Director for the OB/GYN Residency Program. Along with Dr. Young, I'm delighted to welcome you today. Dr. Young and I are fully committed and devoted to each and every one of our residents, and we want each of you to fulfill your potential, whether that be through clinical work or through global health work or through any fellowship that you choose or any research project that you choose. We are always available by email, phone, or by pager, and we are really looking forward to welcoming you to our program and watching you grow over the next 4 years. Thank you so much for joining us today. Let us take you on a virtual tour and orientation of our Harvard-affiliated Obstetrics and Gynecology Residency Program.
Being on the labor and delivery floor at BIDMC is a lot of fun, and we get to see everything as residents. So what's really great is that there are greater than 5,300 deliveries at BIDMC every year, and we get to participate in complex vaginal delivery repairs and operative deliveries, so forceps, vacuum deliveries, stat C-sections, and also we get to participate in cesarean hysterectomies for our patients with placenta creta syndrome disorder.
We not only get the labor and delivery experience of 15 labor and delivery rooms and 3 OR beds or OR rooms, we also get the additional experience of our OB triage center. As a chief resident, I feel very confident in both my ultrasonography experience as well as just my clinical evaluation, given the robust clinical learning and experience that we have here on our OB/GYN floor.
Hi, I'm one of the physician assistants. There are 3 of us here in this department. We support the residents in patient care, both on labor and delivery and in the antepartum unit.
Welcome to the Carl J. Shapiro Simulation Center at Beth Israel Deaconess Medical Center, where our OB/GYN residents do a variety of OB and GYN simulations throughout the year. There is a state-of-the-art simulation center which is accessible to residents 24 hours a day, 7 days a week. Simulation is an integral part of our residents' medical education, with seminars scheduled throughout the year for cesarean hysterectomy, forcep and vacuum-assisted vaginal deliveries, shoulder dystocia, postpartum hemorrhage, vaginal breech deliveries, LEEPs, and cold knife cones. In addition, the Simulation Center is utilized for our Residence Teacher program and is one of the official fundamentals of laparoscopic surgery and testing sites. Our OB/GYN residency required all graduating residents to be FLS trained even before the American Board of OB/GYN requirement, and all of our faculty who practice gynecology are FLS certified as well.
Simulation can really apply to our entire field, and that you can get that really high quality hands-on learning when you have the attending, the teacher kind of right there with you in a way that allows you, that gives you the time and the space to really ask the questions you want.
Where I'm sitting now is our resident clinic space on the 8th floor of our Shapiro Campus Clinical Center. All faculty members, including our department chair, precepts the resident clinic. This is where we see our continuity clinic patients, both obstetric and gynecologic. In addition to our own clinic, we rotate through a variety of subspecialty clinics, including reproductive endocrinology, urogynecology, maternal fetal medicine, and gynecologic oncology, with some special opportunities in additional clinics as well.
Our residency has an incredibly robust gynecologic experience, both with benign gynecology and gynecology oncology. We push the limits to remove fibroid uteri through the smallest incision possible, and by the time of graduation, our residents will have superb surgical skills that are necessary to perform hysterectomies through a variety of techniques, including vaginal, abdominally, and laparoscopically. There are 2 ACGME accredited fellowships, urogynecology and gynecology oncology here. The fellow's role adds to the residents' education and surgical experiences. We have an expanding robotic curriculum, and residents are the first assist for the vast majority of cases in both benign gynecology and gynecology oncology. The chief residents each have their own perioperative clinic where they learn preoperative management, and then each of the chief residents operates on their own patients from their perioperative clinic. The chief residents organize a monthly surgical committee to discuss perioperative surgical management with senior faculty members. We have a dedicated group of faculty members who precept the chief resident surgical cases and are committed to surgical education and development of outstanding surgical skills.
Hi, I'm Katie. I'm one of the third-year residents. Welcome to our junior call room. We're here today to talk to you about some things we do for wellness.
Hi, I'm Corinne. I'm one of the third-year residents here, and part of our wellness curriculum is that we have a book club that I organize and help lead. This week we're actually reading High Risk, Stories of Pregnancy, Birth, and Unexpected, and the author's actually joining us. It is a Zoom book club, but we find these spaces to be really good time and therapeutic for talking about issues in career, being a woman in the workforce, dealing with women's health. In the past we've read Bad Feminist by Roxane Gay and Becoming by Michelle Obama.
Hi, I'm Andrea. I'm one of the third-year residents too. I could talk about wellness outside of work. So I am one of the residents who has a 6-month-old baby, and we actually moved out to outside of Boston so that we can have more space. And what's been really great is that, like Tiffany said, I have a lot of people coming over who to play with me and my baby, and this is really fun.
I'm Devin. I'm one of the PGY2s. For wellness outside of work, I live in the Fenway area, which is just next to here, home of Fenway Park, and I like to explore all the local restaurants with my significant other, go on long walks. I find Boston one of the best cities to be in.
It's really nice that I get to come to work and spend so much time with people who are like family to me in the call room. So we try to be well while working really hard.
In our 2 call rooms, we have a comfortable space for our residents on call to be able to rest. When the residents are on night shift, the hospital delivers healthy, pre-cooked dinner meals, including vegetarian options for all of our residents. We have a robust wellness system in place. In order to promote resident well-being, we have monthly reflection sessions for the residents with a hospital psychologist as a way to process and reflect on our work. We have biannual resident retreats, separate class retreats, and special evenings with a focus on career and professional development. Each resident is paired with a faculty mentor upon starting residency. We organize a month of wellness activities for Feel Good February. We've had wellness events such as Thirsty Thursday, where the residents get together for happy hour, and First Friday, where their nights team gets together for a post-call breakfast. The residency sponsors book clubs featuring books such as Michelle Obama's Becoming and Jamil Zaki, The War for Kindness. The residency is also committed to protecting each resident for 2 hours per rotation for wellness time that the resident can use at their discretion. The hospital has a GME-wide wellness committee. The committee organizes yoga and exercise classes on site, as well as nature hikes and opportunities for volunteering. There is a robust peer support program that is anonymous and open to both residents and faculty. The residents receive book money for supplemental texts to encourage self-education. We have developed a profound reputation for clinical expertise with excellent training coupled with a personal touch. Our diverse faculty have a variety of clinical and research interests, and our residents are afforded unique opportunities to work throughout the Boston area and internationally with our Global and Community Health Division. Our hospital is known as Harvard with a Heart, with humanism being the guiding force behind the clinical care that we provide.